Well, there's no hard and fast rule to considering breast augmentation. Pretty much anyone over the age of 18 can have a breast augmentation if that's what they want. The important things to consider are, is your weight stable? Because that can affect the result if you have considerable weight changes before and after. Are you likely to undergo hormonal changes? So have you finished your family? Are you going to get pregnant and want to breastfeed? Are you going to be hitting menopause soon, which might also change the size and shape of the breast? So all these things are things that would need to be considered in terms of the timing of the augmentation. But it's generally a good idea for patients who want to have fuller and rounder breasts. Well, there's very few patients who aren't suitable. And so I would say the best thing to do is, if it's something that you're thinking about, then come and have a consultation. That's a very straightforward thing to do, is have a discussion with a surgeon, and many surgeons, myself included, will offer a free 15-minute consultation just as a taster to get to know you and you to get to know me. And at that point, you can make a very easy decision as to whether you're suitable for breast augmentation or not. The vast majority of people are suitable for breast augmentation. The only question is whether a breast augmentation alone is sufficient, or whether sometimes there's a need for an uplift as well to get the sort of shape that you're looking for. There are a number of ways performing a breast augmentation. The commonest and certainly the way that is thought the best is through an inframammary approach, which means through a scar in the crease under the breast. So through a small scar in the crease under the breast, a pocket is made that's either above or below the muscle of your chest wall. And where that pocket is really depends on the amount and type of tissue you have. If your tissue is very thin, and it's likely therefore that your breast is not going to be able to disguise the implant if it's placed over the muscle, and the implant will be visible quite quickly, then often it's a good idea to do what we call a dual plane technique, which is putting the upper part of the implant underneath the muscle of the chest wall, whereas the lower part of the implant remains underneath the breast tissue to give its expansile effect. And that kind of gives you the best of both worlds. It does mean that you have to cut through muscle, which is more uncomfortable. It takes a bit of a longer recovery, and there'll be some degree of movement of the implant beneath the muscle. But the vast majority of the time, that's a good payoff, rather than having an implant that's visible in those cases where there's not enough tissue to cover it. So breast augmentation, like any surgery, does come with a series of risks. The risks such as bleeding, which we try and control at the time of operation. There's a very small risk of infection and scarring beneath the breast not being as nice as it could be. All breasts are asymmetrical, so that's not so much a complication as an inevitable fact. Your sensation can change, and very occasionally those changes can be permanent. You can get fluid collections beneath the skin, and awareness of the implant as a foreign body inside you, which is also a very rare thing to happen. Rupture of the implant you hear quite a lot about, but it's actually not that common. It's about 10% in 10 years. Your body forms a capsule of scar tissue around the implant, which changes over time and can squeeze that implant and change its shape. I would expect you to get 10 to 15 years out of your implants, but it's a bit variable one way or the other, because of course time and gravity continue to press on, weight changes, hormone fluctuations, they can all change that. There's a very rare form of cancer called ALCL associated with breast implants, but it's very rare indeed, somewhere around about 1 in 25,000 implants. Breast implant illness is another condition that's a bit more controversial, because we don't have the same evidence backing for it as we do with some of these other complications that I've talked about. And then, of course, there is the risks of general anesthetic, which in a young, healthy, fit patient are very, very small indeed. Any surgery can go wrong. If you see a surgeon who says they've never had a complication, they're either lying or they haven't done enough of that surgery. So the truth is, yes, any surgery can have complications. In a breast augmentation, about 1 in 500, maybe 1 in 800 implants can get infected and require removal, and then be replaced 5 or 6 months later. The implants might not drop into their pocket or drop in a different fashion, so sometimes the implant position has to be changed with a further surgery. It might be that the implant ruptures, or you get a capsule of scar tissue that requires further surgery as well. Serious complications with breast augmentation are very, very rare indeed. But there are a few things that do go wrong with breast implants. but thankfully the vast majority of these are very easy to fix.